this is Dr. Purushottam Kumar here. I am practicing as an interventional cardiologist at Prashant Hospital, Muzaffarpur, and I have done my DNB from Narayana, Kolkata. So today we are talking about hypertension. Hypertension as such has become if you can say, it is an epidemic disease right now. It is prevalent in almost 60 to 70% of patients who are suffering from cardiac ailments, and much of the prevalence has started in young adults. So hypertension, as per American Heart Association, if you go through the stages, the stage 1 will be around 130 to 139 mmHg systolic and 80 to 89 mmHg diastolic, and hypertension according to ESC will be stage 1 will be 140 to 149 and 90 to 99. So basically hypertension affects your heart, lungs, kidneys, your renal system is adversely affected, your microvessels, your macrovessels, everything is affected. Your endothelium is affected by the hypertension. There will be less amount of nitric oxide. You will land up into ACS. So what is the requirement for, as a patient? What are the things which you are going to do to curb the effects of hypertension? First is the lifestyle management. You have to be very active, lose weight, reduce your obesity, reduce salt restricted diet. Second of all, in diet, you have to take DASH diet, that is dietary advice to stop hypertension. That is very important. A list of a number of ingredients is available. You can go through that list on the internet. And the blood pressure monitoring has to be done very effectively. Ambulatory blood pressure monitoring has to be done. If a patient is hypertensive, you have to see both HBPM and ABPM. HBPM is home blood pressure monitoring, and ABPM is ambulatory blood pressure monitoring. Now, there is a lot of debate which is better, but in cases, if you are going to a tertiary care, you should go under ambulatory blood pressure monitoring. Ambulatory blood pressure monitoring will also give you idea about whether you are at risk of CAD or not. That we will analyze that through dipping status. A cardiologist has to see that if the blood pressure at night reduces by 10% or not. If the blood pressure reduces by 10%, then he's a dipper. If it does not dip, then he's a non-dipper, and the risk for CAD increases. And then there comes reverse dippers, in whom you can see the night blood pressure is much more higher than the day blood pressure. You also have to see that if the patient is compliant to the medicines. One of the biggest cause of patients having hypertension not coming down with medicines is because they are not taking the drugs properly. If they are taking the drugs properly, they are following your advice, you're following your cardiologist advice, your physician's advice, then most of the time your blood pressure is under control. Third and most important, there is an entity which is known as the resistant hypertension. Basically, it is defined you are taking 3 types of different classes of antihypertensives. Among those, one has to be a diuretic, and still your blood pressure is more than 140/90. So you have to see an n number of causes: the compliance, the renal artery status, if there is stenosis or not, which is much more prevalent in young individuals. Then the patient's pheochromocytoma status, the other hormonal conditions, if he is suffering from Cushing's, Addison's disease. You have to see n number of things, and then you have to manage this resistant hypertension. At any point of time, if the BP is more than 140/90, you need to have a target BP of 120/80. You can go through the SPRINT trial, which is a very important landmark trial in cases of hypertension, which shows that reduced blood pressure in that cases has reduced mortality also. So at the end of the day, I'll give you a message that if you control your hypertension, if you control your diabetes, and if you have a healthy lifestyle, you have a healthy heart, and you can maintain a healthy forward life. Thank you so much.